When I became diabetic and things started happening, of course I was unhappy, and they had told me that there's no hope. You know, we can do what we do, but neuropathy is one of those things that we can't treat.
When I was originally diagnosed a few years ago with neuropathy, and I was told at that time there was a possibility in a few years' time that I could be in a wheelchair.
I was tired of being in pain, and my legs would go numb, and my back was very sore.
I was very frustrated prior to coming here to the clinic because I was experiencing numbness and tingling in my hands and pain at times. Sometimes I had a hard time even bending my fingers and loss of strength in my hands, unable to open a water bottle or a jar. But also I was experiencing very severe neck pain, especially at night. The neck pain would keep me from sleeping the entire night. I'd have to get up in the middle of the night and take ibuprofen because I felt like I just couldn't even move my head from one side to the other without extreme pain.
Before I came, initially I was in a hopeless state, thinking that there was nothing that was going to help my neuropathy. It was to the point to where I felt like I was walking on big balloons, not stable at all, fear of falling again. It just was a hopeless state, it really was. Painful. I could not sleep at night because my feet were so freezingly cold and achy and painful. You know, it was something different, yes. Never experienced anything like it in my life. I had visions of all the horrors that you hear of neuropathy, the amputations, no feet, no leg, whatever, on and on and on. I didn't do something proactive that it was just going to continue to progress, to get worse, not better. That was the hopelessness, the fact I just wanted to know what to do, what direction, where to go, where there was some hope of just maybe even lessening the symptoms a little bit.
I was having major issues with burning feet last fall. It was kind of a shock. I'm a 63-year-old, healthy as a lark, hunting, fishing, golf, walk, climb a mountain backwards if I wanted to. Next thing you know, my feet started to burn. When I mean burn, there's like a blowtorch on them on certain activities, walking quite a bit, which didn't bode well because when I'm a nurse, I'm on my feet all the time. Next thing you know, I have to sit and put my feet in ice water to get them to not burn. So after some tests through a healthcare provider, not much was happening. Basically, I knew I had an issue, couldn't narrow it down. I had epidural shots, I had MRIs, I had medication, and it was just nothing was working. And it was like, well, now what? I guess I'm on the street.
Well, I was having burning in my feet and toes and sharp pains in my toes, and some of the pain would start coming up my legs, and my feet felt a lot cold, you know, a lot of the time. So I decided to do something about it. I know I've been to medical doctors before, and they said, well, there's nothing we can do. Matter of fact, one doctor gave me a pill that was supposed to help, but that was 5 years ago, and it didn't help anything. Things just kept getting worse.
I was diagnosed as a type 2 diabetic 10 years ago, and it was diagnosed because I was having neuropathic pain. I had numbness, tingling, pain in both my feet to the point where I couldn't keep my covers on at night. So I went and got tested. My A1C, if anybody of you are diabetics and know what that means, it was above 7, and that means automatically that I now have diabetes. Over the course of the 10 years, the neuropathy progressed. It went from my feet up to just below my knee, and it was getting worse, and I just became extremely worried about that because I don't want to, and I'm an active person, but I was becoming less active because of my feet. My balance was terrible. I couldn't feel my feet, so I always had to look where I was stepping to make sure that my foot was where it was supposed to be. I don't want to end up with amputations on my feet, my legs, anything like that. And as a type 2 diabetic, that's a very likely thing that can happen because the neuropathy does progress.
My feet were getting, and my balance especially, was getting so bad that, but the next step was almost a wheelchair. If I'd go to one of the major stores, I'd usually take the little carts that they have, like Menards or Hy-Vee or something like that. I'd usually take the little carts and drive through the store with that, and it was getting sad. Yep, I was getting pretty worried about it. Mainly numbness and balance issues were my two things that bothered me the most, you know, and I had fallen a couple times at home, especially during the night. If I'd get up out of bed, go to the bathroom or something, I'd fallen a couple times and and I was getting pretty concerned about that.
It's very stressful because I constantly had to be on alert to watch him and to make sure that I walked next to him so that he could hang on to me. We couldn't go over it, so we did purchase a scooter so that we could go and do things together. Otherwise, he couldn't walk from here to the wall. And that was very stressful. Well, and then he'd fall at night, and I didn't sleep well because I'd have one ear listening for him.
I was told by the medical field that there wasn't anything that they could do. Well, that's not true. The results, you've got the result. I've made progress, and I'll continue to make progress. And you've given me the first glimpse that I had of hope. And so we started the sessions here. And I'd have to tell you, the people here are great. They're really concerned, and I was impressed with them. And I've been going through the therapy, and I just talked with one of the doctors, and she told me, you've made remarkable progress. And I feel better than I felt in a long time, and we're really happy about it.
I went through a lot of some of the tests, some of the therapy, and I felt that I did get a little bit of relief, but nothing compared to when I actually got with Axiom. My husband insisted that I try Axiom, and I was pretty hesitant about doing it since I had already been through some treatments, but I am so glad I came. The staff here is fabulous to work with. I have gotten myself, in the matter of the number of months that I've been here, feeling back in my feet. I can wear shoes again. I'm not dealing with the pain, the constant pain in my feet. It is well worth coming here. The one thing that I have to say, the home therapy, you've got to be persistent and aggressive, and I think that has helped me a lot.
I feel so much better, and my legs are getting stronger again and easier to walk, and I'm very happy with the results already. My back doesn't hurt like it did. My legs don't go numb when I stand up. My balance has improved, and I've had great results. Much more comfortable, and I can accomplish more things because I don't want to sit down all the time. Strength for my job, more coordination is coming back. Totally positive.
Well, I know that it seems a little impossible to believe, but after my very first treatment, I went home and put ice on it that night and went to bed, and I didn't wake up the entire night with pain. In the morning, I woke up and I'm like, wow, I slept the whole night without pain, and the whole day I went without any pain in my neck or lower back. My fingers were back to normal. I picked up my crocheting and crocheted for hours and didn't have any symptoms. And that was just amazing to me, that in just one treatment, it could make that much difference. So I'm really anxious to go forward with how can this help my life long term by repeated treatments.
I have been truly blessed. I'm able to do my profession, which is a pastor. I can now stand and preach and without pain. I get to sleep at night without pain. My feet are no longer freezing. The balloons are gone. I can now walk confidently and comfortably and not worry about it falling or being insecure. I can go up and down steps where before I came, boy, that was a scary thing, going up and down stairs. I mean, it was kind of like, okay, I got to find a different way to do this. I'm not going to go up and down stairs. Now I just don't even think about it. Go ahead and go.
I've been through this for our test now, or our therapy for about a month, right, I think, and I'm doing home therapy. And I came in here basically this morning relieved, impressed, and a big emphasis on relief because I am seeing some improvement on my conditions. For the first time this past week, I worked 2 shifts on the floor, and I didn't have to stop and ice my feet. I'm just so relieved and thankful.
Well, I've noticed the numbness is getting a lot better, and since I started, I haven't had any of those sharp pains shooting in my toes anymore, and my feet are a lot warmer. I can tell that the blood circulation is better in both feet at this point, and they say I'm improving real great, so hopefully we keep going. Give it a try. It's really changed the way I feel. It gives you a better outlook on life as long as you know that your feet are getting better and they can continue to get better. I'd recommend Axiom to anybody.
I am extremely happy. My test scores have improved tremendously since I started this program. I'm very religious about doing my home treatments as I was told, and sometimes I'm not very good at that. and I've just seen a tremendous difference. My balance is so much better. As I said, I don't have to watch where I put my feet anymore. I can walk looking ahead instead of down at my feet, which is better for me anyway. I'm becoming more active. This has improved my life so much, I just can't even believe it.
It's so much better. We go places and he can walk up steps. He just had to go for some tests at the hospital, and the nurse said to him, can you walk 2 blocks? And he said, yeah. And he did. He walked 2 blocks and didn't face him a bit. Otherwise, he would have never made it.
And you have to believe in it. You have to give it a try. It'll work.